All right, welcome everyone to a new episode of the Roscoe's Wetsuit Neuro Podcast. I am your host, Toby Passman. On the show with me today, we have a special guest, Dr. Dwight Jennings. Dr. Jennings is a dentist and TMJ specialist with expertise in treating orofacial pain, non-surgical orthodontics, and dental orthopedics. Dr. Jennings has been practicing neuromuscular dentistry for over 25 years and has been involved in clinical research and creating new therapies for a large number of medical and developmental disorders that are associated with TMJ, jaw bite misalignment, and high levels of systemic inflammation caused by the pain neurotransmitter substance P. Dr. Jennings, welcome to the show.
Thank you very much. It's a pleasure to be here.
So talk to me about what originally got you into neuromuscular dentistry, which is maybe actually a topic that we should first, if you could first kind of define, because I'm guessing a lot of the listeners probably haven't heard of it before.
Yeah, so dentistry historically has been based on occlusion, and they've looked at occlusion structurally. That is, they think teeth are supposed to fit together in a particular manner. But neuromuscular dentistry, which was invented in the late 60s in Seattle by Jenkelson, looks adds another variable to the mix, and that's muscles suspending the lower jaw. So under neuromuscular dentistry, they're looking at where the muscles want the lower jaw to be, because the muscles that suspend the lower jaw have a very precise place and space that they are most happy. Muscles are strongest at their resting length, and so muscles attached to your lower jaw to be strongest wherever they have to function the most and have the least biomechanical advantage. And for the vast majority of people, that's tip to tip, which is in conflict with the vast majority of dental opinions. Most dentists think you're supposed to have a slight overbite, right? Those upper teeth come a little bit down over your lower teeth, but all primitive humans bit end on end, tip to tip. And that's biomechanically where most people functionally want to be. And so when you put an overbite into the system, the musculature posture in the jaw is forced to work harder all the time, and it induces an elevated tenseness and tonicity within your trigeminal nerve. And so my treatment is to find that most relaxed position for the jaw to calm and quiet the trigeminal nerve.
And how many people are suffering from a misaligned bite, would you estimate?
Well, the vast majority of people are overbites, or people's bites have been getting worse at a very fast rate for the last 200 or 300 years, they think, from soft diets. And so these days, the vast majority of humans are compromised to some extent. The research on all continents around the world is showing that children are all significantly worse than their parents. So this has turned into a pandemic. There was a book published about a year ago called Jaws, a story of a hidden epidemic. And it's all about how that compromised jawway is leading into airway and other airway compromise and other issues.
And how did you originally how did you even find out about this field, or how did you kind of get into this very specific area of medicine?
So right out of dental school, I located to a small community in the Sierra foothills, and I was practicing there where there were no specialists in the county at all. And so I had to do a very broad spectrum of treatments. And I started studying European type orthodontics, which uses a lot of functional appliances. And they've known since back in the 30s and 40s how to bring jaws forward. And that's knowing those skills, I was able to treat more and more of these conditions. And about 10 years into practice, I sold my general practice and limited just to orofacial pain, dental medicine, and jaw orthopedics.
So I want to now go to substance P, which I know is one of your big focuses. I'm wondering if you could kind of break down what that is, why people should care, and then also kind of the association between substance P levels. And I know you're looking at kind of a variety of different diseases, not just confined to, facial pain, but kind of
Right.
systemic issues. So tell me about substance P and its role in kind of
So,
human health.
so substance P is a neurotransmitter, actually a neuropeptide, and the difference is that it does not have a reuptake mechanism. So when it gets secreted in the body, it lingers and has kind of like endocrine effects on the body. But substance P was discovered in 1931. And about 1980, they started doing a lot of research on it. So under PubMed, the National Library of Medicine, which has 30 million articles, there's about 25,000 articles that talk about substance P. So it's very well studied, very extensively studied since about 1980. There's only one pharmaceutical that's been developed so far called aprepitant that blocks substance P, and it's approved only for treating nausea after chemotherapy. So it's about a $250 pill that a lot of people are using off-label for numerous other things too. But it's really not an appropriate way of treating chronic long-term elevated substance P conditions, which a lot of people find themselves having. But substance P has been shown to be so what substance P does to the body is it opens up cell membranes, makes cell membranes porous. So it's like kind of creates leaky gut throughout the whole body. And when you open cell membranes and lower the voltage potential on cells, cells fire too easily. So as substance P levels go up in the body, then you get more inflammatory conditions, more neurological conditions, a lot of skin disorders. Substance P controls smooth muscles, so it can cause intermittent diarrhea, constipation. It's also modulatory, meaning that you don't get the same response. It's not a linear response. At a certain level, you get a response. At a different level, you get a different response. And at a different level, you might get the same response. You got lower. So it's not always predictable what kind of response you're going to get from substance P. But substance P has been implicated as to a primary driver of most forms of cancer. In the last 5 or 6 years has been shown to be the primary driver for most mood disorders, for depression, anger, violence, addiction, PTSD. It's implicated as to the primary cause of fibromyalgia. Typically in fibromyalgia patients, they have 3 to 5 times normal levels of substance P in the spinal fluid, where it opens up cell membranes and you get a calcium influx into cells that messes with mitochondrial function. You get a lot of mitochondrial functional disorders, including chronic fatigue syndrome. It just has a very broad spectrum of applications in many diseases. When you lower cells and they fire too fast, that's allergies, asthma, autoimmune disorders. So, most people that have allergies, if they were to ask their physician what causes that allergy, their physician wouldn't be able to articulate that. They probably wouldn't say they didn't know, but researchers are very clear that they know it's primarily substance P driving allergies and asthma.
And how specifically is the jaw kind of modulating the substance P levels throughout the body?
So substance P is primarily produced in the body by the pain neurotransmitters called C fibers. C is in Charlie. C fibers are 100 times more dense within the trigeminal, your sensory zone for your face, from here to top of your head, from ear to ear. This sensory zone has about 100 times more dense C fibers than any other part of your body. So when there's a dysfunction here and this nerve gets overexcited and the C fibers are stimulated more frequently, then it disproportionately over all other sensory dysfunctions causes substance P levels to become elevated in the body. And that's what's not well known in the medical profession or dental profession. And so as the bite goes off, which is now pandemic, substance P levels are going up, and you're seeing just a much greater incidence of inflammatory conditions these days than we've had historically in the past.
And some other conditions I know that that you've talked about and I've seen mentioned being related to substance P, like seizure disorders. Can you talk a little about that?
Sure. There's very extensive medical literature on seizures and substance P. Again, it's as that substance P attaches to cells, as both even the cells in the brain, those cells will fire too easily. The voltage potential drops, and then they fire too easily. And so substance P is implicated as to a primary cause of most forms of seizures. And I have in my many years, probably in excess of 80 cases of grand mal seizures that have gone away with jaw orthopedic therapy, with aligning jaws and improving the bites.
That's fascinating. The other kind of neurological sort of group of conditions being like neurodegenerative diseases that I know also are definitely connected with substance P. Can you talk to me about, and I know you also recently wrote a paper regarding Alzheimer's and substance P, is that correct?
I don't recall writing one on Alzheimer's. I may have, but we have dealt with a number of neurodegenerative diseases, including Parkinson's. But the literature is very clear. It's substance P levels spiking that excites the brain, and then these cells burn out. And as substance P levels go up, it causes a decrease in nerve growth factor, and you get a substance P controls stem cell differentiation. And so you don't get the repairability in the brain. You get the cells burning out. And so you get a gradual decline in certain neurons in the brain as substance P levels go up. So long-term chronic bite dysfunction, I believe, is a major factor. Also in the trauma incidences in professional sports. And in a lot of the neurodegenerative diseases. We've had really good success like on addressing MS. And I think there's the medical profession doesn't quite have a clear understanding of that disease, but we've been able to reverse a number of the peripheral neuropathies by means that's a little different than most conventional theories, I believe.
And tell me about like some just kind of being on the front line of actually like treating individuals like with primarily kind of elevated substance P levels, as we've talked about with all these different conditions. Like what were some of like your like early experiences kind of I guess connecting the elevated substance P with people's conditions, and then how treating their jaw has made such an impact?
Yeah, I think the first insight, I was working with some researchers back 30 years ago on chronic fatigue fibromyalgia, and I had a case in which a lady was in an auto accident, and we were treating her for headaches. And a year into treatment, she confided in me that she had had 6 seizures a year all of her life until I put the mouthpiece in, and she'd got an entire year without a seizure. And I ran that by the Jay Goldstein, one of the major researchers that I was working with. And he says, "Oh, that's a substance P reaction." And I go, "What's that?" And so at that time I started looking at substance P, and we've just had a lot of other pathologies that we now know are substance P driven, been able to reverse them since that time. And so substance P is now a little more known, particularly with chronic pain management people, but they don't know that the critical factor on substance P levels systemically throughout your whole body are primarily from your bite. And that has to do with the density of pain fibers in the trigeminal nerve.
And so tell me about like in terms of when you're actually working to kind of lower the substance P levels by correcting the bite. You alluded to kind of the bite guards. Can you kind of tell me about what the goal is there in terms of changing the positioning of the jaw and how that improves substance P levels and therefore people's symptoms or conditions?
Right. So when you're doing this, yeah, it's real important to know what the priorities are, to not get lost in the forest for the trees. And the primary priority when you're treating somebody is to make sure they're on that relaxed closing trajectory, right? Where that jaw wants to swing in space, so it's not torqued off a trajectory when you close. And so what's most important is proprioception, right? Those are the sensors in your teeth and muscles that tell the brain where your jaw is in space without looking. And so the jaw proprioceptors have their own nucleus in the brain called the trigeminal mesencephalic. And that nucleus is composed of the only sensory cell bodies in the brain. So when we developed as humans, for some unforeseen reason, the highest priority was your jaw alignment, and that was stuck in the brain, and it has a massive influence on brain function. So it has a massive influence on your reptilian brain, your reticular formation, and that's your primary center of sensory integration and movement origination. So when your jaw's off and your trigeminal mesencephalic nucleus is overworked, it has a massive influence on the reticular formation, and you get movement disorders. So bite therapy has been shown to be highly effective at reversing movement disorders of all types. That's Tourette's, dystonia, torticollis, scoliosis, Parkinson's, a number of other movement disorders. That nucleus is also paired side by side with your sympathetic ganglion in the brain, your locus coeruleus, right? And so when there's jaw dysfunction, you go into sympathetic overdrive, and you often see severe anxiety attacks, panic attacks, and people are always just a little bit revved up and uneasy. And again, that's a major factor in opioid addiction that's not recognized, right? So substance P has been shown to be the primary driver on addiction, but it also ties in a little bit through the bite and its influence on the sympathetic ganglion, sympathetic dominance. And these people are just always in disease. They're not at ease, they're in dis-ease. And so it's that proprioception, getting that jaw closing on a relaxed pattern and hitting on a precise right-left position, so there's no torque going on in the bite. Because of the way muscles are strongest at their resting length, and they have to service the furthest point from your joint, which is tip to tip. So muscles typically adapt and want to be biting end on end, which I know is in conflict with most dentists, but functionally, having done it for, in excess of 40 years treatment, this works like a charm. It works really, really good.
Are there any like psychiatrists or psychologists that you know of who are like paying any attention to substance P? Because like from what you had just said, it seems like something, anxiety, depression, like big psychological conditions that most people associate with, say, serotonin or GABA levels. It's not often talked about, rarely ever talked about, that substance P or the, locus coeruleus might be kind of the driver of those. Have you ever come into contact with any psychologists or psychiatrists who even know about substance P?
You'll find a few that have heard of substance P, but I haven't found any functional psychiatrists that are actively applying this modality. I have not come across any that are doing appropriate referrals and screenings and looking at these problems in this way, in a structural way, in a sensory way. Right? They're thinking it's all just in the brain, and that they don't have much handles on that brain other than trying to talk them out of the problem. I haven't seen that. Now, if you look at the Amen clinics, what they're doing with their SPECT scans, looking at regional cerebral blood flow, the trigeminal nerve here controls regional cerebral blood flow in the brain. So most of what they're trying to manage pharmaceutically is actually neurologically modulated by the tone of this nerve. That trigeminal vascular system is why when a boxer gets hit in the jaw and you do too much sensory input, they pass out, right? And it's why you get a brain freeze if you use too much cold stimulation, right? It's how this nerve modulates brain blood flow. And I've had numerous cases where certain bite dysfunctions will lead into episodes of fainting, or they'll get into cognitive dysfunction, fogginess, a lot of cognitive impairment with reduced regional brain flow, or they can get into a TIA, a transient ischemic attack, and get paralysis in certain migrating paralysis in different parts of their body, I've never in 40 years plus years ever had a neurologist consider trigeminal vascular as a mediator of a temporary ischemic attack to the brain. It's just not on their radar. It's not part of their differential diagnosis.
Have there been any cases that really stand out when it comes to your experience working with patients, when it comes to, say, like mental health or cognitive functioning type things, as far as when you kind of correct the positioning of the jaw, and like what ends up happening, or what has happened?
Yeah, well, I had a patient want to bring me her, was his 15-year-old son. I think it was in seventh grade. And he was on the spectrum, autistic spectrum, and he was pretty violent in school. And he had a pretty compromised future. And as we treated him, he had a very dramatic response. And whenever he would start acting up with his dramatic response, the teachers would say, it's time to go see your dentist again, right? And he ended up calming down significantly. He still stayed in special ed, but he ended up being the only person in special ed that got a real high school diploma. And the mother is convinced that what we did for him saved his life. She thinks that he would have continued to be very violent and not behaviorally appropriate to maintain a job. And today he's gainfully employed, and that's just fine.
That's really interesting.
Yeah.
Tell me about like some other, I know you've talked about like some like substances that modulate substance P levels. So besides just changing the positioning of the jaw, like what other sort of things change how substance P is expressed?
So the main thing that depletes substance P out of the body is cayenne pepper. So cayenne pepper stimulates nerve fibers to release the substance P, and it eventually exhausts them, and you get a decrease in substance P levels. But a number of other things help mitigate the effect of substance P. That would be your resveratrol supplements, quercetin. Most of the spices also help mitigate the effect of substance P, cinnamon, vanilla, turmeric. Their acupuncture lowers substance P levels. Some of the electrotherapeutics will lower substance P levels. There's a phenomenon out there with histamine syndrome, and some of those they're into. They think there's a condition where they think people have too much iron in the body, and they're doing bleeding on these people. They're doing blood draws monthly, every 2 weeks to every month, to help them with their symptoms. And I think what in fact they're doing with the blood draws is that's depleting the substance P levels, and that they may be totally off course on what the actual real problem is. But the blood draws do seem to help these people. But yeah, you get wide interaction of conditions with the substance P levels going up. So basically, as substance P levels go up, it makes the body become hypersensitive. That's the vast majority of my patients. They have a hypersensitivity syndrome. They're more sensitive to noise, to light, to hot, to cold, to food, to drugs, to stress. And when the body becomes hypersensitive, then it gets sick all the time because it can no longer appropriately respond to sensory input. So a little bit of sensory input and they go off the charts, and they get ill, right? They get bedridden with pain, or they get, mood disorder, or they, it's just not, they're no longer calm, cool, and collected. They're very volatile. These people are hyperreactive, which is these days, if you think about the autistic cases, all the allergies, all the food allergies, that's the other thing. Substance P levels naturally and normally become elevated with chewing, right? That's substance P is a major regulator of smooth muscles. So when you chew and your substance P levels go up a little bit, then it turns on gut motility, and the gut processes what just went down there. But if you're chronically running elevated substance P, then when you chew and have a meal, you're going to tend to have a reaction to what just put down there. You think it's a food and not just a chewing process. Like there was a long COVID case. I was listening to a talk show here about a week ago, and this lady called in and said, you know, when I have lunch, halfway through my lunch, I have to go take a nap, right? Since she's got long COVID. Well, in COVID, there's these cases, as I see them, have an elevated substance P before they get sick, and they still have an elevated substance P after they're sick. And it's that elevated substance P that causes a lot of these post-COVID symptoms, the long COVID symptoms.
I was actually just going to ask you about that because I know that was one of the topics you wanted to discuss was substance P and viral susceptibility. So
Right.
what exactly is going on there? Like, do we know, or what do you hypothesize in terms of why are individuals with substance P levels more likely to get COVID? And then you're saying also they're more likely to get like long-term
I'll
effects of
go into
COVID?
it. Correct. So the research is very clear, though very unknown, is that substance P opens up cell membranes and allows viral and spirochete infiltration. So I think it was Dr. Woe, Children's Hospital, Philadelphia. He's published very extensively, claiming that if you could control substance P, you should be able to control HIV. But for the substance P opening up cell membranes, the HIV virus would not be able to get into the cell. And this would apply to all viruses. And so as your substance P levels go up, you would be prone to viral infiltration. So substance P controls the collagen matrix. So that's why people with lung problems, lung fibrosis and other problems are prone. Substance P controls anger, violence, and addiction. And that's why prisoners are all highly predisposed to COVID infection. 50% of prisoners have got COVID, right? Substance P goes up as you get obese. So obesity people are more affected. I think probably in the minority populations where they're more heavily afflicted, there's going to be a lot more poor dental care, more loss of teeth. Loss of teeth typically leads to a lot more jaw torquing and jaw dysfunction, bite dysfunction. But the viral propensity, viral infection propensity goes up as your substance P levels go up. So as bites are now a lot worse in the world than they were a century ago, where they were, 50 years ago, we're all getting really bad at a very fast rate. The prospects are very high that we're going to continue to have more often and more severe and more frequent pandemics.
What, going forward, do you see like other methods of treating elevated substance P levels besides correcting the bite going forward, or do you just see that as kind of being the most important one that will be kind of expanded in terms of as people get more familiarized with substance P and just jaw dysfunction? Do you see neuromuscular dentistry kind of becoming a much bigger field, or are there going to be other ways to deal with substance P?
The pharmaceutical people will come up with more substance P antagonists, but substance P is such a major regulator that it's very difficult to not get a lot of side effects, and so that's the problem they've had. They've been looking very rigorously at trying to find substance P antagonists. And they will come up with more. They'll come up with more. There's now in the last 2 years a researcher out of Spain who's a very strong advocate of substance P antagonists in the treatment of most forms of cancer. But again, treating cancer by trying to block the substance P receptor would not be nearly as effective as getting rid of the substance P, right? And that's the difference between trying to treat it pharmaceutically and treating it with precision jaw orthopedics. But our medical model in our institutions, it's a long ways for the dental profession and the medical profession to become more integratively oriented and do things right. We're all looking for a quick fix and a pharmaceutical pill. So
Do you do you see that as being a possibility that it, sort of those interdisciplinary connections are kind of strengthened, or do you see this as a continued problem going forward?
it will develop very slowly, I think. I think it will develop, but it'll be a very slow process. And it's not, dentists don't want this responsibility. You know, they want to just stay with the structure and not have to deal with function and the medical model. But the orthodontic profession, I think, may get faced with it because doing straightening teeth is not the same as aligning your jaw. And you can't align jaw with braces or Invisaligns. And that's where the orthodontic profession is at this point. They're going to need to learn how to use functional appliances. You have to get temporary acrylic between the teeth to align the jaw, to know where to put the jaw. And that's the problem with orthodontics, is that they try straightening teeth by leaving the jaw in the same position. They're not really taught how to assess, find, and align the jaw before they make their orthodontic diagnosis. You need to know where the jaw needs to be before you can really know what needs to be done. And they don't do that. They just tell you bite down. Here's, you know, they're going from a purely structural standpoint. You know, some people, when they have an overbite, some of them functionally, most of them want to be here functionally, but there's a significant portion of them that want to be here. That is, not only is the lower jaw back, but the upper jaw's back. So when you get the jaw lined up and they're like this, then you have to bring that upper jaw forward, right? And all the treatment and development in the dental profession to treating sleep disorders, sleep apnea, is making them look at that more critically. But I still haven't come across other dentists that clearly understand the simple criteria of how you find out where a jaw needs to be. It's a 15-second procedure that any general dentist could learn, but nobody's doing it. Nobody's screening their patients, because some of these patients, like I just had a new patient this week with, trying to think what she came in for. Oh, she got referred in for seizures, I believe. But both her mother and father are dead, and 2 siblings are dead, one from alcohol and the rest from drug overdose, right? And she has severe anxiety disorder. She's on total disability, right? I know what she got. She didn't get referred in a seizure. She got referred in because somebody put her in a night guard and it changed her bite. When they put a night guard in there on her and opened her bite up a little bit, her jaw jumped forward, and now her teeth no longer match up in the back, right? But her jaw came partially forward, and she needs to be brought forward even more, but bringing her forward even more will likely cure her anxiety disorder and likely get her off of her 6 medications that she's on, right? And likely give her back her life, right? Because right now her anxiety won't let her be able to maintain her job. And so you get this whole familial dysfunction, the whole families that are severely disturbed with inherited bite problems.
If someone, you know, who's listening to this thinks that, you know, they might have a bite problem, or they recognize that maybe they know of someone who might, you know, besides, well, I guess they could come to your clinic, obviously, but where would you like direct those people, like, because it seems like there's a very small number of specialists who are actually dealing with like the functional aspect of dentistry.
So the primary organization that deals with the functional aspect is the International College of Craniomandibular Orthopedics. So it's iccmo.org. I believe it's .org, but it's the International College of Craniomandibular Orthopedics. And they have a member. You can go in there and find a dentist on their website. And the problem with most of them is I don't think they've been highly trained in the medical association. And so, you should be able to look at a medical history on a dental patient and know whether they need to be screened, because people with jaw dysfunction have a continuum of disorders throughout their lifetime. Kaiser did a study on people with TMJ problems, and they found that they have very high medical utilization rates. So they get sick at a high rate for a very broad spectrum of diseases. So as that substance P levels go up, it causes chaotic dysfunction. And so it's not predictable what's going to happen to you when you get elevated substance P, right? So what you typically see, though, is you see more ear infections than likely in childhood, but not necessarily. As they get older, you see more allergies, asthma. As you get into the teens and 20s, you see more headaches, migraines. As you get into the 30s and 40s, you'll start seeing more musculoskeletal problems, because that trigeminal has a massive influence on neck, spinal tone, right? As you get older, you'll see more autoimmune disorders. And I believe as you get age more, you'll see more cancers problems.
So by kind of changing the bite or substance P levels, you think, I mean, just overall as a society, we could become a lot healthier.
Exactly. Yeah.
If only people were to know about all of this stuff.
Yeah. If the dental profession, the dental profession has just totally ignored this, right? This is not in mainstream dentistry at all, right? There's still a large controversy as to how you treat TMJ problems, right? There's still a major school of thought in most universities that it's a psychosomatic problem, not a structural problem. And so under that model, you treat it with physical therapy, biofeedback, stress management, but you don't look at functionally where that jaw wants to be in space.
Awesome. Well, Dr. Jennings, I really enjoyed our conversation today. Any closing thoughts before we wrap up? Anything related to substance P or bite dysfunction that we haven't talked about yet?
I think that was pretty good. There was something that came to my mind a minute ago on the some of the other brain. Oh yeah, so the jaw nerve, where it controls that regional cerebral brain flow, and as that substance P opens up cell membranes, that also impacts blood-brain barrier. And people with long-term cell porosity from elevated substance P, they tend to accumulate heavy metals. So there's a lot of comorbidity that goes on with this that gets labeled as a lot of different things. And that's typically what you just see in these people, is that they've got a lot of morbidity, but nobody's ever gotten back to the actual primary pathology. Right, the primary pathology manifests and gets a lot of different labels, but nobody's understanding substance P and the bites, and they just don't get back. One of the main screenings for jaw dysfunction is just to stick your little finger in your ear and pull forward, and you're not supposed to be able to feel your jaw joint opening and closing through your ear. And there's a lot of people, when they bite down, their jaw joint goes way back into their ear space. It's associated with hearing loss, ear infections, eustachian tube dysfunction. A lot of people have difficulty clearing with the altitude if the bite's off. Scuba diving, flying, those kind of things are very problematic for them. But another peculiar things is that substance P, where it controls stem cell differentiation in the bone marrow. So there's researchers that think that substance P is the sole cause of leukemia, right? Substance P controls stem cell differentiation, so it controls melanogenesis. So with our patients, we see a high number of pigmentation disorders. We have some case histories where the pigmentation dysfunction has dramatically normalized with the bite therapy. And so just very broad impact on the body that's not well recognized.
That's fascinating. Well, Dr. Jennings, if people want to connect with you or find out more about kind of what your clinic's doing, where would you direct them to go?
So they might look at our website. We're at tmjcalifornia.com. We're located in Alameda, California. We are next to the Oakland airport. We service a very high percentage of fly-in clientele. We're more than glad to cooperate and work and train other dentists in their locale. They can locate someone that's of interest. So yeah, we're more than happy to reach out and spread this word.
Awesome. Well, Dr. Jennings, thank you so much. It was a pleasure having you on the show. And if the listeners enjoyed the show, go ahead and like and subscribe to our YouTube channel. We're Roscoe's Wetsuit. You can also find audio versions of the podcast available on Spotify, Apple Podcasts, Stitcher, and pretty much any other major podcast streaming platform. So, Dr. Jennings, again, thank you so much for coming on today.
Appreciate you having me, Toby.